Hey everybody, Danna here. I wanted to give you a quick update. Last time I posted was the day of surgery, and that was a week ago today. So it's been a week ago Monday since I had my lumpectomy and my um, lymph node biopsies. I've got back my pathology report. I went to my post-op meeting with my surgeon 2 days later, and she was pleased with my progress and gave me some great news. So blessed, so thankful. Thank you for all your prayers. This surgical pathology report basically says that the margins on the lumpectomy, on the removal of that little tumor, were clear, completely clear, no cancer seen in those margins. And they removed two sentinel lymph nodes in my right axilla, and those were both clear as well. So that is the best news I could ask for. That was, the most important thing that I was waiting on. Now, a couple other updates. Well, first of all, I have continued to have no real pain, but interestingly, at about 4 days in, I felt a little bit of swelling and tenderness, but not enough to take Tylenol or anything else. It's just not even necessary. So I had a consultation with my health advocate, Nancy Rizzo. I really hope if you haven't watched the video with her, the interview, it's a little long on the long side, but she's so brilliant. Chatted with her. I try to chat with her on a video chat once a week. And I do want to tell you, if you need a health advocate, and it doesn't have to be if you have cancer, she's amazing and very affordable. 30-minute consultation, and she's very efficient. It's just so worth it. She guides me through nutritionally. She answers my questions. And I'm shared that today because I am leaning toward radiation. And I just did a little interview after my consultation with her. I asked her to talk about the mat technology, the PEMF mat I've mentioned before that I lay on to help balance my whole electroconductivity in my body. She's going to explain it very well. So we're going to do one little segment on this mat and why it can help our health, and it's especially helping me with my cancer journey. And then we also did another video on radiation and what it is, and the reason for using it for post lumpectomy. And the more I talk to her and understand ways to safeguard my tissue and what kind of tissue that the radiation targets, fast replicating cells, which are cancer cells, but also the biggest damage that you already know of is skin cells. So that's why you can get that radiation burn, but it goes away. And then, of course, there's some other potential risks. But the more I'm studying, and again, I've been praying, studying, gathering my facts. So as of today, I'm 80% sure I'm going to do radiation. I'm going to ask the protocol be written out completely so Nancy can review it with her 20 years in radiology. I've been promising to tell you more about my diet. I've just been busy and trying to recuperate. I mean, I've walked every single day since surgery, to include, except for the day of surgery, um, about 1.5 miles. And I have done leg weights. I'm not supposed to work out, but I walk up this long, pretty steep hill, a couple hills on my walk, and I just feel fine. I literally feel fine. Continuing to do some juicing. Juicing has been new for the last 2 or 3 weeks, but it's really keeping my body more alkaline. And so I promised to do more on my diet. I will. I've got lots of pictures I've been taking. I'm going to tell you very comprehensively what I'm doing, but I just haven't had time to do it. I'm trying to keep on top of work and so many of our Eat, Live, Thrive coaching clients. But again, thank you for your prayers. One more interesting tidbit. So I got a call from the medical oncologist with her assistant saying, we want to order I guess it's called an oncotype of your tumor to see if you are a candidate for possible chemo, if this tumor tissue is responsive to chemo. And I said, well, I'm not going to do any chemo, so there's no point in doing it. And so I said no to that and canceled my medical oncology appointment. And then promptly within an hour, I got a call from my surgeon's assistant who said, we hear you're not going to do this, and you certainly don't have to take chemo, but she really wants you to know as many facts as you can about your type of cancer. So I don't know what more I'm going to learn. I'm going to have my meeting with the medical oncologist. That's the gal that I got so frustrated about that didn't talk about anything other than drugs. But I'll report back on that because it's just in fact finding. I'm going to get the oncotype done and find out what she has to say. And I'm going to give her a chance to give me some alternatives to something I'm not going to do, which is any form of chemo, even if I'm a candidate for it, because I really feel confident, especially with the radiation. I'm not going to need that. It's overkill and killing probably things that I don't want to kill. So that's where I'm at today. God bless you. Thank you for following my journey. I will continue to post, and I do promise to get you on my diet and supplement regime really soon, but I'm going to post the videos from Dr. Nancy first. God bless everybody. Take care.